Hi friends, I am Dr. V.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the inborn errors of the metabolism. These conditions are detected in early life, relatively benign and are familiar, occurring frequently in consanguineous marriages. To count some are galactosemia, fructosemia, glycogenosis, mucopolysaccharidosis, Hurler's syndrome, Hunter's syndrome, Marfan's syndrome, lipidosis, Gaucher's disease, Niemann-Pick's disease, Tay-Sachs disease, Resform's disease, plasma lipoprotein disorders, disorders of amino acid metabolism, phenylketonuria, 16 Hartnupp's disease, porphyria, Wilson's disease and periodic paralysis. These diseases have certain features in common. Galactosemia. It is an inborn error of metabolism of galactose due to congenital deficiency of a specific enzyme galactose L-phosphate uridyl transferase, which is necessary in the conversion of galactose 1-phosphate to glucose 1-phosphate. It is inherited as an autosomal recessive trait. Clinical picture is physical and mental retardation due to accumulation of galactose 1-phosphate in the tissues. Clinical manifestations: vomiting, diarrhea, weight loss and lassitude after a milk feed, jaundice, hepatosplenomegaly, ascites and edema may be followed by death. Slow evolution group. Disease grows unrecognized for some time. Later, mental retardation, convulsions, hepatosplenomegaly and cataract may develop. Investigations: absence of reducing substances in urine, malituria, hypoglycemia, hypergalactosemia, galactosuria and aminoaciduria. Paper chromatography confirms the excess of galactose in urine. Galactose 1-phosphate uridyl transferase deficiency in red cells confirms the diagnosis. If the red cell concentration of galactose 1-phosphate exceeds 2 mg per 100 ml, the treatment is ineffective. Treatment: elimination of milk products by galactose-free diet. In severe cases, galactose may be avoided for life. Fructosemia. It is a rare autosomal recessive disorder characterized by fructosuria. Liver biopsy specimen shows reduced 1-phosphofructoaldolase activity. Treatment. Treatment is avoiding fructose and sucrose. Glycogenosis, glycogen storage disease. Metabolic derangements may occur either in synthesis or degradation of glycogen or its subsequent utilization, resulting in variety of disorders called the glycogenosis. Glycogen, the branched chain polysaccharide, is stored in the liver and muscle. In the metabolism of glycogen, the following process takes place: von Geyk's disease, hepatorenal glycogenosis. It is rare and characterized by the accumulation of glycogen in the liver, kidney, and intestinal mucosa. The disease is due to the deficiency of enzyme glucose 6 phosphatase. Converts glycogen to glucose, common in infancy and early childhood. Clinical features: hepatomegaly, hypoglycemia, fatigue, vomiting, drowsiness, growth retardation, ketosis, convulsions, and coma. Treatment: omitting the galactose protein and amino acid in the diet. Glucagon injections are used. Glucose may be added in small quantity in feed to prevent hypoglycemia. Bempes disease: cardiac glycogenolysis deficiency of acid maltase enzyme is responsible for symptoms related to cardiac dysfunction. Clinical features: cyanosis, dyspnea, tachycardia, restlessness, and failure to thrive. Findings: cardiomegaly, globular cardiac Silhouette murmurs, ECG, inverted T-wave, ST, depression, wide QRS complex, and left axis deviation. Treatment: there is no specific therapy. Symptomatic treatment is given. Mucopolysaccharidosis. These are a group of inherited disorders of mucopolysaccharide metabolism. It has clinical, genetic, and biochemical features. Mucopolysacchariduria and glycol protein are accumulated in the body. Hurler's syndrome. Alcoholism. It is similar to the mucopolysaccharide disorder and is due to the overproduction of acid mucopolysaccharide and a heavy granular substance which accumulates in the body and is deposited intracellularly in many body tissues like skin, liver, cornea, brain, skeleton, and spleen. Clinical features: paucis, grotesque social appearance, profuse nasal discharge, cloudy cornea, prominent supraorbital ridges, shrunken nasal bridge, hypertelorism, large tongue, and widely spaced skull. Often deformed scaphocephale, hydrocephale, oxycephale may be present with delayed closure of anterior frontallae. Stature: moderate dwarfism, short neck and dwarf dorsolumbar kyphosis, skeleton hands with short sturdy fingers, contractures of fingers, elbow, ankle, knees and hips, and genus vulgus. Others: umbilical and inguinal hernia, hepatosplenomegaly, thick skin hirsutism, and congenital heart disease. Treatment: no medical treatment is helpful. Surgical manipulations may be helpful. Hunter's syndrome. It is a sex-linked recessive with gradual mental deficiency. Deafness is frequent in many systems, same to the Hurler's syndrome. Marfan's syndrome. Arachnodactyly, Dolichotinomalia. It is an autosomal dominant hereditary disorder of connective tissue. It affects the ocular, skeletal, and cardiovascular tissues. Ocular: cataract, subluxation of lens, megalocornea, strabismus, and nystagmus. Skeletal: arachnodactyly, abnormal length of fingers and toes, tall and thin built, tubus skull, and arched palate. Winging scapula, Pigeon chest, hypermobility of the joints. Cardiovascular: dissecting aneurysm, mitral or aortic incompetence, and dilated pulmonary artery. Others: dislocation of the hip and renal artery. Treatment: Low methionine, cysteine supplemented diet along with large doses of pyridoxine and attention to the cardiovascular complications. Deformities of the spine and lenticular defects. Lipidosis, an increase in the lipid content of the serum or tissues. Antenatal diagnosis is possible by amniotic fluid cell study. Common disorders are Gaucher's disease, Niemann-Pick's, Tay-Sachs disease, gangliosidosis, metachromatic leukodystrophy, Fabry's disease, and Krabs disease. Plasma lipoprotein disorders. Lipoprotein contains a combination of cholesterol, phospholipids, and glycerides. There are two types of described: beta lipoproteinemia, familial lipoprotein deficiency, hypo-beta lipoproteinemia. Familial lichen cholesterol acetyltransferase deficiency, hyperchylomicronemia, or familial beta hypolipoproteinemia. Disorders of amino acid metabolism. Mental handicap is a major disturbance associated with errors of amino acid metabolism due to the concentration of amino acid substance. These are preventable and few tests are there to detect these disorders. Gaucher's test, ferrichloride test, phenylketonuria, PKU. It is the deficiency of hepatic enzyme phenylalanine hydroxylase. The conversion of phenylalanine to tyrosine is impaired, causes accumulation of phenylalanine and its metabolites in the tissues, then excreted in the urine. The disease is inherited as an autosomal recessive trait. Clinical features: bland hair and pale skin, severe mental retardation, IQ of 30 or less, accentuation of superficial and deep reflux spasticity, tremors, seizures, and short stepping gait, mousy odor of the urine and sweat, eczematous and photosensitive dermatitis, neurological impairment, phenylalanine in blood and bloody fluids, urine show phenylpyruvic acid, phenyllactic acid, and phenylacetylglutamine. Investigation: ferric chloride test to detect the phenylpyruvic acid in urine. Serophenylalanine, phenyl aminocephalography shows the evidence of cervical atrophy of the frontal lobe. Treatment started as early as possible. Maintain normal phenylalanine levels to 3 to 7 milligrams per 100 ml. Diet containing low phenylalanine with stopping, as it may cause anemia, skeletal changes, and growth retardation. Balanced diet started from the first 2 weeks. Prevention: necessary to start treatment before intellectual impairment occurs. Screening of infants and genetic counseling of the phenylketonuria women. Hartnupp's disease. It is autosomal recessive disorder with skin rash, cerebellar ataxia, and mental retardation, coarse nystagmus, high stepping gait, hyperreflexia, renal aminoaciduria. Treatment: protecting from sunlight, nicotinamide is helpful. Porphyrias. Disturbance of porphyrin metabolism may be congenital or acquired, classified as hereditary hepatic acute intermittent porphyria. AIP. Porphyria cutanea tarda, PCT. Erythropoietic acquired porphyria due to excretion of porphyrins in their precursors in urine in large amounts. lead poisoning, obstructive jaundice, and collagen disease. Wilson's disease, hepatolenticular degeneration. This familial condition is characterized by progressive degenerative change in the basal ganglion, cirrhosis of liver, accompanied by greenish yellow or greenish brown pericorneal pigmentation. Caser's pleasure ring. The metabolic disturbance is now accepted as involving copper containing enzyme, notably in the respiratory chain. Increased urinary excretion of copper and amino acids and decrease in ceruloplasmin. The diminished synthesis of ceruloplasmin appears to be genetic. Disturbance and Wilson's disease occurs as a recessive condition. Clinical features. Starts late at about 11 to 15 years. Dysarthria, dysphagia, dysphonia, difficulty in mastication, deposit of copper in the descendants membrane. Caser's ring is present in 90% of cases. The tremors besides may be hemolytic anemia, multiple fractures, splenomegaly. Treatment. Dimercaprol BAL in a dose of 4 mg per kg 4th hourly for 10 to 12 days every 2 months can stop the progress. D-penicillamine 20 mg per kg 24 hours is the drug of choice. Calcium disodium versinate in a dose of 75 mg per kg per day, IV in 250 ml of 5% dextrose in normal saline over a period of 2 hours, 2 times a day for 3 to 5 days. Triethylene tetramine dihydrochloride or L-dopa may be tried. Lesch-Nyhan syndrome. It is a sex-linked recessive disorder. Waardenburg's syndrome comprises of congenital deafness, periodic paralysis, disturbance of potassium metabolism, hypo or hypercalcemia, periodic attacks of flaccid paralysis, muscles of extremities or loss of electric excitability. That's all about the inborn errors of metabolism, and in the next video I will discuss about some other disease. Thank you.